So today I want to talk a little bit about diabetes type 1 and how it's a breakdown of cellular communication. How many of y'all know someone who has diabetes type 2 or 1? All right, so quite a few of you guys. Well, okay, there it goes. Cellular communication, to start off, to give you guys a little bit of a background so you know what the heck I'm talking about, there's two types of it. There's local and long distance. These all happen in your body. The long distance uses hormones in your bodies that travel from your brain to other parts of your body. There's a gland right here in your neck called the thyroid that helps distribute some to other parts. There's a gland here in your brain called the pituitary gland that's kind of considered one of the biggest glands in your body job-wise. It's actually pretty small, the size of a pea. Local regulators are normally chemicals. Neurotransmitters are a good example of these. Neurotransmitters are on your nerves, your neurons, and they're chemicals that are released by the end of them, called the synapse. They go across the synapse gap to the dendrite, which is the long branches on your nerves. They take that and they keep sending that signal down, and it's quite fast. It's kind of a quicker way to communicate rather than hormones. Hormones take a really long time to go through your bloodstream. And on the cell, the target cell that you're trying to get to, there's multiple different types of receptors. There's ion channels, but the one I really want to focus on, which has to do with diabetes type 1, is the receptor tyrosine kinase. These are receptors that go all the way through your cell membrane. They come in pairs called dimers. That after they receive their ligand, which is a signaling molecule, that's whenever they join. Because they're normally separated until they get their signal. They come together through a process called dimerization, and that's where they become their dimers. Now, we spend a little ATP here from 3 different molecules called adenosine triphosphate, which is ATP. All 3 of these, 2 of them are taken away from each to give you 6 phosphate groups. And they became adenosine monophosphate. The receptors inside the cell membrane have little tyrosine molecules attached to them, and these spent phosphates attach to those tyrosine. And they connect, and they just help denature or change the structure of proteins in the cell to act what the signal wants that cell to do. Those AMP that are now spent are turned into cyclic AMP to help just get them out of there. So this is a little diagram of what receptors do. This is something else to do with diabetes. This is whenever there's not enough or too much sugar. This is where diabetes goes wrong right here. This is what it normally does. You got your receptors that come together, active, and their signal transduction happens, the gene happens. Now, what does diabetes have to do with this? First off, diabetes has 2 types. Type 2 is an acquired case of diabetes. That's what my grandmother has. She's an example of this. It's where she's ingested so much sugar, glucose into her body that her body just, instead of producing more insulin to counteract this, it completely stops insulin. It doesn't do what it's supposed to. And the pancreas is just there. It's not producing insulin anymore. So in order to treat that, you have to have insulin injected into your body almost daily. But type 1, that's where it's different. It's not an acquired case. It's an autoimmune disorder. It's an autoimmune disorder where the antibodies from your immune system attacks the beta cells on your pancreas, which produce insulin. Insulin is needed to break down that sugar that's in your blood from eating stuff and after digesting. So people with diabetes type 1 need to watch their blood sugar levels a lot. It's very common to hit them having high blood sugar so they need to watch that. In RTK, the proteins which make that insulin production that are changed are affected and not able to make the cell produce the needed insulin to help break down those sugars in your blood. But here's the thing about diabetes type 1, about getting it. It's known as a complex trait. This means that the disease is not just caused by one gene, it's caused by multiple. Diabetes is not guaranteed if the parents have it, but it does put the child at an increased risk of acquiring it. This is the normal beta cells. This is what happens. They'll form, they'll see that there's too much glucose, and then so they'll make insulin. You can't really see this because the projector is kind of off, but you can kind of notice that there's differences right here. These are your insulin producing cells. This is your capillaries, and this is where the insulin comes into the bloodstream, into those capillaries. All these cells are normal right here. They're producing insulin, which is what you need. All these affected cells, which have been attacked by the immune system, aren't. They're not producing insulin. And that's what's wrong in diabetes type 1. I think I skipped one, so I'm going to go back and get that. Just give me a minute here. Here it is. All right. So in normal insulin production, you have high sugar, and the insulin is released by the beta cells, by this pancreas. The fat cells are taking the glucose from the blood, and you have a normal blood level. Whenever you have low blood sugar, though, something called glucagon is released by the alpha cells. This is the correct, that's sugar, and the opposite of insulin. Insulin and glucagon are related. They help regulate how much blood sugar you have, but whenever this isn't here, sometimes this isn't needed. As you can probably figure that out. You've already seen this, so let me take you through here. So, the symptoms of diabetes type 1. People afflicted with diabetes type 1 have multiple symptoms, including excessive thirst, fatigue, hunger, nausea, vomiting, blurred vision, fast heart rate, headaches, sleepiness, or weight loss. Of course, since no insulin is being produced, people with diabetes type 1 have high blood sugar levels. That's where they have to watch and be careful, because if that gets too high, that could wind up with them in the emergency room, and you don't want that. As with all diabetes patients, ketones, which are chemicals that we learned about earlier in this class, and they're being produced in the body, and you can tell that because whenever you smell a diabetic's breath, it smells fruity. This is known as diabetic ketoacidosis, or DKA. DKA, my bad. So what do you do about diabetes type 1? How can you treat it? You can't really correct those cells because they're like nerves, like the myelin sheath nerves. Once they're destroyed, they don't regenerate. So you have to regulate you have to try to insert insulin, try to get that normal insulin levels and put you back down into what should be the normal blood sugar levels for that patient. There are many types of medications you can take. You can take insulin, dietary supplements, and hormone treatments. Different types of specialists deal with this, kind of like endocrinologists, because this has to deal with hormones, because insulin is a hormone. Nutritionists and pediatricians.